I'm a practicing rheumatologist. I deal with both children and adults. And we also, rheumatology being a vast specialty, we are dealing with connective tissue disorders. We're dealing with, in essence, most of the time, some form of pain. And it's been proven that most visits, by far, to physicians, something hurts. So as a rheumatologist, you're always seeing people in pain for whatever condition, rheumatoid arthritis or lupus. And even though you're fighting the immune system often, you're always trying to help somebody not hurt.
About 2 months before I took the job here, I was in an automobile accident. I was rear-ended. I was taken to the hospital on a backboard. They thought I had broke my neck.
So in my practice of rheumatology, many years ago, the concept of topical medicines was always an intriguing concept, but you couldn't get much. I then went off to teach at St. George's University, which is a Caribbean medical school. In the Caribbean, because it's European-based, you could walk in the drugstore and buy Motrin in the tube, diclofenac in the tube, right? Just go in there, you don't have to even prescribe it. And it helped. And then I was introduced to Medistat.
I went through about 4 months of physical therapy. I found out about our pain cream. My doctor recommended it. The first time I used it, I felt immediate relief.
Now they gave some options, not just one single non-steroidal, which is like a Motrin drug, but topical gabapentin, which I had read about for nerve pain and muscle relaxers, and that doesn't, by definition, exist in a cream, but they were able to make it. So I was highly excited, remain highly excited. I've had cases where people have avoided surgery.
I didn't want to take any kind of pain medication. I use it. I've also found that I can use it. I have a torn cartilage in my knee from abuse earlier. I use it on my knee too.
So if you have a bad knee, a bad back, it's a wonderful adjunct. It makes common sense, and people want to do it. It's just we haven't had the tools. You're giving it to people who conventional treatments aren't working. I mean, if somebody could take a Motrin and they have no pain, we wouldn't be talking. People who are on medicines not responding, because why would we write a prescription for a topical if they were responding? Now they're better. So it's common sense. Why it's not been like this in America, I don't know.
I just couldn't be happier using that because I know this is a long-term thing, and just not to be able to have to take medication anymore is really a relief. So
I'm excited about the use of the topicals. The company has really been wonderful. The products have been excellent. I think the quality, I've seen some of the quality measures that they use to test their products to see exactly the components by independent labs. So I've been, before probably it existed, I was an advocate, and now since they do, I'm their biggest advocate around here, I think. And I am, because my patients get better. So as I've indicated, with using these Medistat topical medicines, we can treat the pain where it is, not the whole body.